Good evening, good afternoon, and good morning. This is the 1828th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Hema Mistry. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting
Dr.
Homeopathy.
Dinesh, just sorry to interrupt you for a minute. I hope the celebrations are going well in Kerala.
Yes, we
all
are.
the best to your team, and your efforts will make it a great success. All the best to all of you. I will not be able to make it, but my sincere wishes and are with everybody. Thank you so much.
Doctor, in case Dr. Hema Mistry is unable to share, then can you share the PPT if I forward the same?
Myself? Okay.
Dr. Hema Mistry is trying to, may try to, because she is coming out this Zoom session for the first time and she may find it.
Okay. Yeah, sure.
Okay, then I shall send it. Okay.
Yeah.
Okay. Let us begin the session. And as you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have an international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again, and you can subscribe the same without paying in money. And as all of you know that the purpose of this forum is to promote homeopathy among people around the world. And today our guest is Dr. Hema Mistry, and Doctor has completed MD Homeopathy and PGICR, consultant physician, freelancer, skin cosmetology and homeopathy 3060 healthcare, Mumbai. She has completed MD in 2008 and PGICR from ML Dawale Institute of Clinical Research and have worked under seniorities of clinical assistant in ICR and Keki Channel, Bombay Hospital, and worked with the Nash Homeo and Dr. Badras. She is the ex-lecturer as well as in Kerala Homeopathic Medical College and admin in all Bombay medical science updates. And today, Doctor will be discussing about role of case taking in homeopathy. So we proudly welcome Dr. Hema Mistry to the session. Welcome, Doctor.
Yeah. Thank you. Thank you,
Please
Dr. Yeah, just a second. Yeah. I wanted to know about the sharing of the slides, if you can.
Can you share? Try.
Yeah. Yes.
Let's try.
Yeah, thank you, Doctor. Very good evening, friends. This is my first session.
Have you shared? Have you shared?
Yeah.
But it has not come out.
Share.
Please stop the screen sharing and restart once again.
Okay. Yeah.
Okay, now it's okay.
Yeah. So today we are going to speak most important aspect in homeopathy, that is the case taking. As regards case taking in homeopathy, it is very important as to understand the patient, because we treat the patient as a whole and not the disease. And how you approach the patient is very important. Approach of the patient by initiating his preliminary data, that is name, his religion, caste, culture. You come to know a lot of things as to his background, his age, his sex. So you can differentiate the diagnosis according to that. And a lot of information you get as to what background is coming from his preliminary data. As you take the data from the patient, you also need to collect the data from the friends to affirm and to have the other other information also. Besides taking the information from the patient, it is very important that how you build up the report. The report is the key how you open the door. So when you are case taking in homeopathy is the foundation stone. Hello,
Yes,
hello.
madam. Yes, madam. We can.
You all can hear me, right?
Yes. We can hear and
Yeah,
hear.
yeah. So case taking is the foundation. So any building you are or any construction you want to build, and it needs to have a solid foundation on the basis of which your entire therapeutic treatment or further planning programming, how you are going to deal with the patient, all this leads to a success only when your key is the rapport you built up with the patient. So in initial phase only, it is very important when you are collecting the data to build up that rapport. Observation is the next key. Observing the tone of the patient, the pauses, the nuances, his expressions as to the patient is hurried, whether he's very laid back, or how his composite is there, how he's sitting physically in front of you. A lot of his body language will give you a lot of information as to observation and objective symptoms. Besides that, in case taking, it is also very important that you learn the art and science of homeopathic interviewing. So when you are asking the patient, and he comes with his first complaint, that is his chief complaint, his presenting complaint, which is very important to him. So we are going to try and understand that the first symptom what he is very important to the patient, how he is expressing that. You need to take the detailed information of the same as to origin, when it started, the onset, the duration, how it progressed, the site, the direction. In homeopathy, it is very important to understand the details of his presenting complaints as to his location, what kind of a pain it is, if it is a pain, or what kind of a sensation it is with the complaint, which will get you a lot of individualization as to the patient is concerned. Here, I would not like to use the word patient. We use often in homeopathy, but we should be using the word person because we are dealing with an individual. So whatever is important to that individual, that is his feeling, that is the sensation, the modalities, what is it that is aggravating his complaint, when it is worsened, what part of the day, time, whether hot, cold, or any particular thing which is causing or triggering that particular symptom becomes very important for us. Also, the something which is called as associated symptom, which is not directly related to the disease or that part of a problem, but it is at the same time it is occurring, which is called as concomitant symptom, which also becomes very important symptom in homeopathy because that belongs to the individual and not the disease. So in homeopathy, the signs and symptoms are more of an individualistic signs and symptoms of the person or his constitution. So whenever you are making a diagnosis, when you're taking the history in the probable diagnosis, we give more importance not to the common symptoms of the patient, but to the individual symptoms. And that is why we need to explore the data more in detail as to get the person and the personality behind this individual who is coming with his presenting complaint. So another thing is that you will take is the past history of the patient. So whatever he has undergone, the medical treatment, the surgeries, the treatment, the medicines he has taken in the past, what drugs or medications he is on. All this will give you a more detailed history as to any relationship with the current problem or anything that has developed in that patient due to certain past histories. So any predisposition, also the family history becomes very important. So any genetic predispositions, any inheritance is there, any tendency is there in the family, which will help you understand the patient much better. Besides the family and the present history, it is also very important to understand the temperament, the mind, because in homeopathy we believe that in person all our physical diseases or physical illnesses are core in interrelationship with the mind, that is the mental and the emotional state of the patient. So a lot of things which is interrelated, you need to explore that, and that will be explored only when the rapport has been established in a way that the key is right, and you can open the entire door and the patient lets you in to see and observe and feel what the patient, you'll be able to understand better. So once you have understood the patient and you are further exploring in the deeper zones, in the deeper levels, you need to understand the circumstances of the patients, the journey of the patient right since the beginning. That is in the chronological sequence, that whatever situations, circumstances, right from his childhood to his family area, the if he's working, then if he or she is working, then the work environment, the kind of the stressors what are there, whether the patient is having any sort of anxiety, fears. All this becomes very important as to the remedy selection in homeopathy. That's why whenever we are trying to explore any mental symptoms, we go into understanding the person in a better way. We try to explore and try to understand what the patient is feeling. Not everybody in the anger will react in a similar way. What triggers that anger? The anger may be different. Somebody may get physical, somebody may just suppress it, somebody may express it in the form of tears. So how the patient is reacting to that particular one emotion becomes very important. So there can be also an emotions sort of love, but how you express that. For them, somebody may be just dutiful or handling the responsibilities in the form of love. So to understand the underlying emotions of the patient is very important. And anything which is very individualistic, that is the symptoms which are not belonging to the disease but are very peculiar, very singular, very striking, uh, which is not in relationship to the disease symptoms, becomes very important individual symptoms, to which homeopathy gives importance as to selection of the remedy, because that belongs to the whole person as a whole, as an individual. Another aspect of homeopathy is the holistic approach. We are not treating any disease in particularly or any organ, we are treating the person as a whole. So that organ or that particular disease is in that person, which has evolved due to certain cause. So we need to try and understand as to, and to rule out the cause, we need to explore as to what is causing that particular symptom or what has developed that. So when we see the chronological sequence in the line of events, we'll find a particular pattern, or you can say a trend, that that is repeated in that patient, which is very individualistic, which makes that patient or a person very unique person. This individualization is very important in homeopathy to catch hold, and which can have the similar remedy, and to differentiate amongst all the remedies. So analysis of entire understanding of the data analysis becomes a very important aspect of homeopathic case taking. So it is called art and science of homeopathy. Another thing is when you are exploring or the patient, that trust, that faith has to be established. You cannot be judgmental. You need to make the patient very comfortable, so that and you should be listening to the patient, you should be in a very receiving mode, and patient should feel understood. That is very important aspect. So your body language as to receiving the patient and listening to the patient becomes very important aspect for him to open up and to feel comfortable, and have that faith in you, so that he's able to share his lot of things. In between also, you need to see that how the patient is expressing is there are some unspoken cues also which you need to understand from the patient's body language and behavior, and you need to be very empathetic. There is a understanding that Dr. Samuel Hahnemann has said that role of physician, the knowledge of physician is very important. So the knowledge is when it comes to as to how you are understanding the patient from the point of view of his background, the culture, his family upbringing, and in this all aspect your knowledge will come into light as to how much you have the knowledge. And besides that also, you need to understand that in understanding the patient, besides the knowledge, you need to also have that kind of when you're interrogating with the patient, you need to ask indirect questions, not the direct questions. The patient should not feel offended or should not shut down, or not at any point feel that you are trying to intruded into his personal space. So all the indirect interrogation will help you flow in smoothly in his entire case, in the entire case taking. Another thing is when you are when you are gathering the information and the patient's data, you need to understand the events in his life, his circumstances, how he has been reacting to that particular situation will help you understand the person in a better way. So besides the presenting complaint and the past and the family history, personal history, his life events are very important as to any death or any instances which has occurred in his life which has led to any trauma or any particular stress or any significant changes in his life through that event becomes very important and essential for us to understand the evolution of that particular person, and that impacts on his health directly. So mental and emotional state becomes very important in homeopathy. Besides mental and emotional state, also the physical examination we need to correlate when the patient is presenting with his associated complaints. We need to observe, we need to do the palpation, we should be doing proper examination of the patient. Any tenderness, any swelling is there. A lot of times the patient gets used to any particular symptom. Unless and until we don't examine the patient, we'll not be able to understand. There will be some incidental finding which the patient must have overlooked or must have taken for granted and taken in his own as a habitual this. So careful observation of the patient's demeanor, posture, expressions, appearance, and by palpation we need to understand also the homeopathic point of view, whether the patient is, his palms, soles, whether they are cold, whether they are hot, whether they are very sweaty, whether he is perspiring, non perspiring. By with the touch we understand that the patient's individual physical makeup and his constitutional symptoms. May the objective symptoms help us understand and differentiate his body makeup as such. So, a thorough review of all body systems often we need to further explore by asking patient. So, if the patient is anemic, that will help us understand better his diet, his routine, his sleeping patterns, and his what is his daily routine in the life as he wakes up, what is his diet, to understand his sleeping patterns, his appetite, his habits, his likes, his dislikes is very important in homeopathy, as to whatever is general and very very specific to that individual, his likes, his dislikes, helps us understand that person better. In homeopathy it is more of a individualistic signs and symptoms which help us select the remedy. So it is very important to collect this information. Also, when we are collecting the chief complaint or any associated complaints, we try to explore them in very much detail as to understanding the side and the preferences. The body is exhibiting the signs and symptoms in which side, in which particular direction. Also the time of the day when he gets this worsened, or any particular relation with the weather, whether any position is aggravating it, or any food or drink is causing it, or All this becomes very important to understand and individualize that particular symptom with respect to that person. So somebody may have migraine but would have that with extreme thirst. Somebody may have fever with unusual cheerfulness, or may have perspiration and completely drained out, exhausted. So this all symptoms which are there associated, and which is showing the intensity of the signs and symptoms, becomes very individualistic in exploring and differentiating uh, one patient having this similar diseases, but differentiating as a holistic approach and trying to understand the individual signs and symptoms. Why it is important for this entire data when we try to take in homeopathy, why it is important that we are taking this case in a lot of detail and lot of exploration. People say that homeopathic doctor pura itihas puchta hai, he's asking the entire history, right from the childhood till now. He will inquire, and we have to give everything, so much of details they collect. But it is very important because these details only help us to found the basis of totality of symptoms on which we have the remedy selection. So the data collection becomes very important, and having in a very systematic chronological way, so as to evaluate the patient and the person as a whole. We need to also analyze the, if anything that which is very peculiar, which is very strange, which is very striking, very queer, which is not expected, becomes very important for us to understand that this is very much individualistic as a sign and symptom in that particular person, which will help you select the remedy in homeopathy, and that differentiates that person from the other persons having the similar disease. So, analysis and prioritizing the characteristic, peculiar, and uncommon symptoms, differentiating between common, becomes very important aspect in homeopathy. And trying to build up the entire holistic picture of the individual, and trying to understand that person as a unique personality that is differentiating him or her from all other people. So, what is that uniqueness of that particular patient becomes very important as a core or as a central aspect. Case taking itself is a very central core of homeopathy, on the basis of which the entire therapeutic planning, programming, or the entire therapeutic treatment that will take you long to understand and to treat. Also, the follow ups become very important after the entire detailed case taking and analysis of the same. So, when you're taking the follow up, you'll be able to understand that how the medication, how the remedy selected is responding, and to get the follow up analysis, how you establish the entire case taking, depending on the same, the patient will be able to travel with you, to be able to express and be able to follow up with you regularly, and he may have the faith and trust in you on the basis of how we establish our rapport during the case taking. So it takes you very long. The successful case taking will build up the entire case and the treatment. So, how your initial interview is, how your detailed inquiry, physical examination, repertorization. So, when you are taking the symptoms in homeopathy, we give importance to mental symptoms, the emotional symptoms, which are very individualistic to that person. We give, secondly, the importance to very peculiar, strange, queer, or rare symptoms which are not uh, any way related to the disease but are belonging to that individual, will become of importance. Also, the general constitutional symptoms that is belonging to the person becomes very important. The modalities, that is, what is causing it, or what is aggravating, what is it that is relieving the patient, which side is or what sensation he is having, differentiates him from the other persons having the similar presentation of any disease, will differentiate him uh, differently from other individuals. In remedy selection also, we need to differentiate, we need to filter. So understanding of the miasm, trying to understand the causation, the entire constitution, as to how he is, whether he is having anxieties, whether he is a depressed person, or whether he is very easily excited patient, or a easily excited person, or how he responds, how he reacts to his environment. All this will help us into differentiating and filtering the remedy, and to decide the entire treatment methodologically. So anything that anybody wants to ask? So documentation of the entire case taking is also very important. We need to write everything in detail, so that the records are maintained. Uh, you need to also understand that it has to be very standardized approach to every patient, that whenever you are taking the case, everything has to be recorded properly, because this will help us reflect, to help us to analyze back. When you are taking the patient's follow-ups, then you need to also go and reflect and analyze. Many times we need to reassess the patient, or we need to maintain this records as to research purpose, or if there is any legalities or anything, the records will help you establish your understanding completely, and to also to educate the patient, to help him understand, give him awareness as to what are the needs, if there is any lifestyle changes it is required, as to his diet is concerned, or as to his sleep is concerned, any maintaining thing which is aggravating his condition. So anything, suppose if he's smoking, his lifestyle, he's having alcohol, and if that is causing any aggravation in his disease, or is the causative modality, we need to see to it that we need to speak to patient, and we need to educate the patient into understanding that these are the hindrances, or this will not help him much, even though the remedies are selected and given to him, but this maintaining factors have to be taken into consideration, and talk to the patient in the right approach, in a way that the patient understands and is convinced. So Dr. Ken's understanding of case taking was, he gave more importance to mental emotional state, because he thought a lot of physical illnesses are directly interrelated to the mental emotions and the mind, and psychological evaluation is very important in homeopathy. And besides that, dreams, because dreams of an individual, interpretation of the same is directly to his conscious to subconscious mind, and that's why he gave so much of importance to dreams. Also the general symptoms, that is his appetite, his sleep patterns, as to his behavioral behavior, his temperament, his moods, and how he reacts and responds to the people in a particular situation and circumstances. All this becomes very important and individualistic. That is what Dr. Ken's approach of importance in case taking was. Besides general, then he gave more importance to the striking features of that individual, that is very peculiar, queer, and strange, belonging to that particular individual, and not the disease, but only the time occurrence is same. With the proper selection of the remedy, when we are doing the follow-ups, we need to understand that we need to see the frequency, intensity. We need to build an entire evaluation of, the symptoms have to be recorded, which the patient has presented with, and we need to evaluate every time that how the patient is responding to the remedy. The potency is decided upon the vitals of the patient, whether his how much sensitive he is, his how much susceptible he is. So depending upon the sensitivity and susceptibility, will be deciding the potency and the repetition of the dose. And the repetition of the dose will be also decided on how the patient is responding to that the treatment. That will decide his follow-up. So we need to gather this information, and the other approach, which Boger's approach was there. So Boger thought that whatever is belonging to the patient in general, and whichever is very peculiar, queer, and strange, so that is the key. That individualistic symptoms of the patient, on the basis of which he is to prescribe. So there are different approaches as to different stalwarts in homeopathy, and we should be able to see that, whatever we are able to understand and find the approach as per the case. It becomes very important. So sometimes if you are taking a a child's case, or if you are taking a patient who is very reserved, who will not give you access, or who will not give you the kind of um, his mental or his temperament or emotional state, he will not be able to disclose, then the approach of case, how you will decide the approach to the entire case, will depend upon that. So the different approaches are there in homeopathy, which will help you understand what should be the approach. And in organon of medicine, Dr. Hahnemann has given the entire understanding of case taking from aphorism 83 to 104. So once you go through that, he has detailed everything as to chronicity of diseases, and every time you need to reassess the case taking. So that is why it is very important that the report, or when you are establishing with the patient, is very important. How you are talking to the patient, how empathetic you are. The patient should be felt heard, listened to, understood very well. He will be able to find in you, as a physician, a friend, guide, or philosopher. So the role of physician comes into picture here. That, what the person who is as a patient is identifying you, the role you play. So sometimes the person may find that you are a fatherly figure to him, or he may find a friend in you, or he may find that, there is somebody who's elderly, who's trying to uh, guide him. So he may confide in you in a particular way, how you establish the role as a physician. And at the same time, the pros and cons of the same needs to be taken into consideration, that you need to maintain the professional distance. At the same time, you need to make the patient very comfortable, and uh, so that he can easily express as to his feelings is there, or as to his emotions is there, any fears, any anxiety, any phobia. So I think in case of you need to understand the entire detailed chronological sequence, the entire history of the patient, right from the childhood till now, and all the situations and circumstances he has undergone. His reactions to that particular events becomes very essential for us to understand in homeopathy. Anything anybody would like to ask? Hello. 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 Hello.
Yes, madam. Yes, madam. It's really excellent
Yeah.
session.
Are you all able to hear me?
Yes, everything fine. Everything fine. I was hearing from another.
Yeah. So I wanted to understand that any doubts, or any other aspects one needs to inquire into.
Yes, let me. Then this part is over by now, and it is. It is
Yeah.
the
So
time. It is the time for discussion, and those who want to participate in discussion can raise your hand, so that we can we will allow you to unmute yourself and we can go ahead with the discussion. As you all know that case taking is an important tool for homeopathic success, because if your case taking is perfect, you win the race by half. And if even without giving the medication, the patient may feel that, oh, you are a fine doctor. He has done a lot of things to me. And what a doctor, I am, for the first time, I am seeing such a doctor. Today, in the evening, by about 7 p.m., a patient came for the treatment of cholesterol. Actually, I told her that cholesterol is not the villain here, but the villain here is your problems. When I inquired about all those things, what I found that the patient was telling like this: "Oh, doctor, I am having anxiety about lot of things." It is the bystander who is telling the doctor every time the patient is worried about her illness, and he's always whenever some bad news here, she may expose some problems with her mind, and thereby she will be totally disturbed. But in those conditions, uh, after case taking, the bystander itself told me that, oh, doctor, your talk itself alone is enough for the patient to get relief. She is 50% cured by your case, even without medication. Because that kind of determination, that is not, that is the beauty of case taking. We simply sit there and watch what the patient is doing, what the patient is telling, whether you are laughing. But what I have seen in what I saw in the patient, she was laughing while whenever I talk about what this cholesterol, and this is not, there is nothing to worry about cholesterol. Cholesterol is not the villain. The villain is somewhere else. So then what is the villain? The villain is your food habit, your sleep. Then when I inquired about the sleep, she told me that, "Oh, doctor, I have a lot of sleeplessness, and that is one of the reasons." So I told her that once you take all this medicine, your tensions will be over, and you will get a steady sleep. And once you get steady sleep, naturally your cholesterol level will come to normal. So don't treat the cholesterol, but I'm going to treat you, the patient, that is the individual. That's what homeopathy, individualization is something that required. But unfortunately, nowadays even a homeopathic doctor is thinking the other way, that the pathology condition need to be cleared first. That is up. It's a ridiculous thing. It's not the way. Really, a homeopathic doctor must think as a homeopath, not as a allopathic way, not in the allopathic way of thinking. And this is what I would like to add. What's your opinion on that, all those things, Dr. Hema Mistry?
Yeah, Mr. Dhanesh, actually, there's a lot of noise here. There's some Ganpati thing going on. There's a lot of dhol and everything here. So I'm and
Yeah,
express.
there is a problem. You cannot hear properly. Is it
A lot of, there's a lot of you know,
celebration?
yeah, big music
Pujas.
or dhol or something going on in the vicinity. I'm
Okay.
unable to hear all. Uh,
Okay.
I would like to add to it. Just give me some time.
Okay.
Okay.
Oh,
So, in case taking, besides understanding the patient's emotional temperament and the stressors or the fears or coping, it helps us understand the coping mechanisms of the patient also when you are taking the case. That how the patient is able to respond to particular situation or the circumstance, whether he's an escapist or whether he's defying, whether he's denying certain situations. That helps us understand the underlying the core understanding of the patient as a person, as this kind of factors are very crucial in homeopathic remedy selections. Also, the homeopath aims to understand the patient as a unique individual and considering both physical and psychological aspects that may influence their health. Homeopathic remedies are prescribed on the principle of like cures like, that is similia similibus curantur. So anything which is causing the symptoms in the patient, any drug which is causing a particular symptom in the patient, and when given in the disease, it will be able to eradicate that signs and symptoms. So as to understand what is treatable in the patient, we need to take the case in a way, in a very detailed way. Case taking helps in identifying the symptoms that are most characteristic and peculiar to the individual, as this guide the selection of the appropriate remedy. Only besides homeopathic case taking, we also need to monitor the progress. The initial case taking provides a baseline against which the patient's progress can be measured during the follow up and consultations. Changes in symptoms, both improvements, the aggravations, are important indicators that help the homeopath assess the effectiveness of the remedy and make adjustments if necessary. Establishing the rapport, as I said earlier, also, effective case taking involves active listening and building a rapport. Suppression, homeopathy aims to stimulate the body's own healing mechanisms. So, unlike the other systems of sciences, which tend to suppress the signs and symptoms of the patient, homeopathy stimulates our own body's mechanisms, or our own body's capacity to naturally heal. And these mechanisms can be naturally healing only when the remedy selected is very similar to your individual. Understanding the complete symptom picture through the case taking helps in selecting the remedies that encourage the body to resolve symptoms naturally rather than just suppressing them. So, homeopathy is able to treat and cure the patient in a very gentle, in a smooth, and in the Herring's law. Whenever we are treating the patient, we need to understand the patient has to be treated from inside out, in the reverse order of the appearance of the signs and symptoms, from the more important organ to the lesser important organs. So this has to be kept in our mind during the follow-ups. Patient's education is also very important during case taking. The homeopath educates the patient about the principles of homeopathy, the expected course of the treatment, the lifestyle modifications that can support healing. This empowers the patient to take an active role in his own health. We need to see that the patient is feeling understood, so that he is actively participating in his own health. He takes the interest, and he that this should empower the patient. We should be able to help him understand better, so that he gets empowered to have an active role in his own health. So this detailed history and gathering of the case involves lot of like past complaints, presenting complaints, history, surgical, medication, allergies, dietary habits, sleep patterns, temperament, fears, dreams, and any significant life events. This comprehensive approach helps the homeopath understand the factors contributing to the patient's current state of health. Also, detecting the patterns and trends through careful questioning and analysis during case taking, the homeopath may identify a particular pattern or a trend in the patient's symptoms. For example, like certain symptoms may worsen or improve under specific circumstances, or there may be a chronological components in the way it has evolved. This thus case taking helps us understand every individual differently from and different helps us differentiate the remedy selection also. The history of the presenting complaints, the past medical history, genetical predispositions, mental emotional state that impacts on the individual health, physical examination, modalities, factors that alleviate, aggravate, worsen, and cause triggers, maintaining factors that are there which causes obstacles or hindrances in treatment, needs to be evaluated and needs to be taken care of. Also, the concomitant become very important, that is the associated complaints which are not directly related to the disease, but are only relation with the occurrence, the time with the chief complaint becomes very important, because that is very individualistic in that particular uh, person. So individual treatment is should be unique. Uh, the holistic approach helps us in identifying the underlying causes of the illnesses and promoting health. identification of key symptoms that are more characteristic to the individual. This guides selection of appropriate remedy, monitoring the progress, baseline for follow-ups. This helps us form the baseline for the follow-ups, building a rapport, therapeutic relationship that is important for successful treatment. This involves active listening. Also, uh, it helps in the selection of the right remedy that helps body to resolve symptoms naturally rather than just suppressing them. Patients education, lifestyle modification, supportive measures. This helps us to empower them. uh, Besides objective and subjective symptoms, confirming the most closely resembling remedy that has to be selected from this totality of symptoms that is representing the person as a more than his disease. So effective case taking helps the homeopath narrow down the possible remedies and confirm the simillimum and filter the same, which is essential for achieving optimal therapeutic results. Individual response to illness case taking explores how the patient uniquely responds to their illness. This includes understanding their emotional reactions, coping mechanisms, and overall resilience. Such insights can guide the selection of the remedy that not only addresses physical symptoms but also supports emotional and mental well being. On a long term health benefits also, it helps us understand the patient and select the remedy, thus preventing the reoccurrence and improve overall vitality, strengthening the body's inherent capacity to heal. Patient centered approach fosters collaborative relationship between the patient and the homeopath, as the role of a physician is established when the patient feels heard and understood and involves in his own healing process. So, with this, as I have also mentioned, the aphorisms right from 83 to 104, there is a mention by Dr. Samuel Hahnemann. He has laid the emphasis on the importance of the detailed case taking and observation, investigations concerning the disease state, accurately questioning the patient and his friends, and by the precise observation of the disease itself. As to investigate, note down in writing everything that the patient and his friends communicate, respecting the history of the morbid symptoms. He has also discussed in aphorism 84 the importance of understanding the totality of symptoms. In aphorism 85, Hahnemann has stressed the need for the individualization in treatment. The most striking, singular, uncommon, and peculiar signs symptoms of the case have to be kept in view, which is belonging to the person as a whole. In aphorism 99, Hahnemann discusses the importance of frequent repetition of case-taking process in chronic diseases, especially which arise from a psoriatic miasm. After the totality of the symptoms has been investigated, one remedy alone must be given at one time, single remedy at a single time. After its action has ceased, another as homeopathically suitable may be given, but not before any indications are there. In aphorism 102, Hahnemann emphasizes the necessity for the patience and thoroughness in case taking. The true physician must be provided with genuine medicines in order to be able to make a trial of several remedies successfully treat. And besides that, the only mission of the physician should be to restore the sick to health, cure as it is said. He has discussed the need for careful observation, individualization, and annihilation of the cause. The cause of the disease should be able to annihilate that. Any maintaining factors has to be uh, taken care of. This is all that I need to mention about case taking. Anything else
Yes.
that you would?
Yes. If anybody has any doubt, you can ask the question, because this is I am inviting Dr. Rapareshwar to say your question as well as your.
Yeah, I'm sorry because in between there was a lot of sudden somewhere in the background there was a lot of
No,
dhol.
this can happen at any time because it is not in our control. Yes.
Thank you, Dr. Dinesh ji, and Namaskar, Dr. Hubert De Silva. And congratulations, Dr.
Thank
Hema Mistry. Very good. Describe the case taking in homeopathy. Totality of symptom. There are two words, subjective symptom and objective symptom. They're very important. Subjective symptom, all symptom, individual symptom, talk the patient, and objective symptom, observe body language, etc. So, case taking, homeopathic is the art and science. Case taking is the very important and select remedy. Totality of symptom according to aphorism 104 and other aphorism. So, case taking very important. Subjective symptom, yani mental symptom, fear, grief, etc., and body language. And so, very, very thanks, Dr. Hema Mistry.
Thank you, sir. And any other seniorities here, any of my peers or any seniors would like to add their experiences, I invite them to share their
Yes,
their
definitely. Case
case.
taking is definitely an art because you just simply sit on the chair and you can see what the patient in front of you is doing. And if you are looking at your phone or sometimes talking at others, you may not be able to see what the patient is doing or acting. And sometimes the bystanders may try to misguide you in some way that they may have a prejudiced view that this patient has this problem and that problem. They may fix on that. "Oh, doctor, you need to treat." But when we open up the case, we can find that there are these are the things that there are some other things that may be the reason behind the illness. And if you find the right reason behind the illness, definitely you will be able to go smoothly. And once the patient sometimes the patient may not open up in front of the bystanders. So in case taking, you will have to sit with the patient and with the bystander. Then you can send the bystander out, and then you can talk to the patient, and then you can even ask the patient to go out and see what the patient bystander has to say. Then you will have to take the decision, right? The right decision. Well, who is selling the right or not? Because sometimes the patient may come and say that the doctor, I'm having lot of torture from my family. She want to express the same, but when in front of the bystander, she may not be. But when we ask about these things in the to the bystanders may say that, doctor, we are caring her in a better way. There is some other person. We are appointed a male nurse to look after her and take care of her. But this is not the way. When so the real reason may be the other things. So that kind of in-depth case taking is necessary to get the right remedy. Homeopathy, as we all know, that if you have a patient coming out, we may get a patient with some other pathology, but when we try to treat the patient in that pathological condition, we may fail the case. But if you get the right uh, mental reasons behind the illness and mental causes behind the illness, we will be able to ride smoothly, and we can win the case, whether it be a chronic case or an acute case, it doesn't matter. What's your opinion
Yeah.
on that, madam?
So I would like to add that, whenever you're establishing a relationship with the patient, we need not be biased or we should not have any prejudices. It's very essential and very important that we are not prejudiced. We need to be very unprejudiced. We need to take a fresh approach completely. Not from the experiences you have had with other individual or other similar kind of patients or person, and or any remedy should not be in your mind, although it comes naturally in homeopaths that they start differentiating and then the interrogation is pushed from the point of view of selecting the remedy. But one should be a fine observer. One should be noting down as the signs and symptoms or whatever the patient is able to tell you in a very unprejudiced way. You need to be noting that, and then you need to evaluate and analyze, and from the patient's behavior, from his way, the way he's talking and the way he's expressing in a similar tone and in a same fashion what patient wants to tell you, then being thank you.
Yes. If any, I am inviting Dr. Maas to say a few words on the presentation, and also you can say what of things to the session at the end.
Okay. Yeah, thank you, Dr. Danish. Actually, to be honest, I was a bit late. I didn't follow from the beginning, but I managed to get the important message from this presentation, which I find very, very important, very informative sharing, because indeed, case taking is very crucial to get to know the real symptoms of the patient. So I think it is a skill that it has to be acquired over the years through experience, and everybody starts at different pace, you know. So I really like to thank the speaker, Dr. I'm sorry I didn't get the name from not stated there in
Dr.
the yeah, okay. Thank you so much, Doctor. Yeah, I really appreciate the sharing tonight. And on behalf of the participants attending the session tonight, I would like to thank you for your effort and your sharing with us. Thank you.
Thank you, Dr. Maas. And uh, as you all know that we, the International Forum for Promoting Homeopathy, is celebrating its 5th anniversary on 28th September. And hope all of you will come over here and register. You can register for the same immediately. The registration fee is rupees 3,000 only. And it is being conducted in a 5-star hotel, that is Taj Vivenda Cochin, the heart of Kerala. And as you all know, it's a place where you can see lot of things, and there are homeopathic medical colleges, homeopathic pharmacies, and all those things. Those who want to visit, we will arrange a trip to that area also. In that way also, there will be some presentation, there will be some talk of short talks and discussion about homeopathic perspectives, and interactive session for students and junior doctors, and there were some talk on agro-homeopathy, veterinary homeopathy, then dental homeopathy, and all those things will be discussed in the session. And at the end, there will be some cultural programs also. So hope all of you will register and come over here. And if those who miss the session can also contribute a good amount for this forum, because we are doing these things for a long time. That means 5 years continuously uninterrupted. So, and so webinars, that means though we began the session in Malayalam, then we were able to upload, connect with English, and then Hindi, and now we would like to expand this into all more languages. So if you support us, definitely we can do such a way. As you know, we are connecting one another, and we are able to promote homeopathy around the world. That's the purpose of the this organization, or I must say, this united movement to protect homeopathy. So hope kindly register your name for this. Yes.
Can I also suggest something that in homeopathy, the right now, what is essential is that we should be having a standardized way of case taking and maintaining the records.
Yes, you can see lot.
We need we
Yes.
establish the follow up and the entire understanding of the case from the point of view of research, so that we are able to present the treatment and the cures, because anything is the any sciences need to be given in the form of proof to the government or to particular state, to the laws and
Yes,
regulations.
exactly. That's what we are doing. And as you know, all these videos are being uploaded. These are all evidences, not most of the doctors present cases. So all these cases are treated with homeopathy and cured with homeopathy. So that's what all about. And because since the time is over, thank you, Dr. Uh, Hema Mistry, and those who attend the session. And tomorrow we will have a session from Dr. Sweta Singh, and Doctor will be talking about some dermatological aspects with homeopathy. So thank you all. Good night. It's over to Dr. Maria Majan to moderate the Malayalam session.